Hello, everyone, and thank you for joining us for this HHS Office on Women's Health Technical Assistance webinar, Improving Maternal Health Through Addressing Endometriosis, Fibroids, and/or Polycystic Ovarian Syndrome. My name is Linda Stella. We're very happy that you're here with us today, and I'm with the Office on Women's Health at the U.S. Department of Health and Human Services. I'm joined today by my colleagues, Candace Marshall-Humphrey, also with the Office on Women's Health, and Dwayne Barlow, one of our colleagues from the Grants Management Office. He's a Grants Management Specialist in the Office of the Assistant Secretary for Health. Next slide, please. Today, we'll provide an overview of the funding opportunity announcement and competitive application requirements. Before we begin, a few housekeeping items. All participants have been muted. We invite you to submit questions throughout the seminar in the question and answer window on the right side of your screen. Please ensure that you select the option to send your question to all panelists. We will respond in a frequently asked questions or FAQ document, which will be posted to grants.gov. As we receive new questions, we will update the FAQ document on grants.gov, so please ensure to check for updates throughout. This webinar is being recorded, and the recording will be available on the Office on Women's Health, or OWH's YouTube channel. So you can always go back and review this and get the information again. But we have an important note. This information does not supersede any of the content of the Notice of Funding Opportunity. The NOFO is the written document that will govern the competition. We strongly encourage you to subscribe to the NOFO on grants.gov to ensure that if there are any revisions made, and this will include in the frequently asked questions document, you'll receive an electronic notification and stay up to date. Next slide, please. Now, some background information on the Office on Women's Health, which sits within the Office of the Assistant Secretary for Health. The Office on Women's Health, or OWH, was established in 1991 to improve the health of American women by advancing and coordinating a comprehensive women's health agenda throughout the U.S. Department of Health and Human Services. The office works toward a vision that all women and girls achieve the best possible health. We do this by providing national leadership and coordination to improve the health of women and girls through policy, education, and innovative programs. OWH has four primary goals. One, inform and influence policies to drive health equity, access, and quality across the lifespan. Two, educate the public. Three, educate professionals. And four, develop and expand innovative approaches to advance the field of women's and girls' health. Next slide, please. Right. Okay. So now to Notice of Funding Opportunity. This notice solicits applications to fund demonstration projects to implement and evaluate evidence-based interventions to comprehensively identify and treat endometriosis, fibroids, and/or polycystic ovarian syndrome, PCOS, with an emphasis on addressing and reducing disparities in underserved communities. Endometriosis, fibroids, and polycystic ovarian syndrome increase the risk of pregnancy complications and adverse maternal health outcomes. Therefore, addressing common conditions like endometriosis, fibroids, and PCOS during the reproductive years and between pregnancies is essential to optimizing maternal health outcomes. Please note, while we include page references to the NOFO on slides as a guide, as we do here, where it says executive summary, pages 1 and 2, it is important that you refer to the full text of the NOFO. The NOFO provides additional information you will need to complete the application. Next slide, please. Focus area. OWH expects recipients to design evidence-based projects that will support women and providers in underserved communities to better understand and identify symptoms indicative of endometriosis, fibroids, and/or polycystic ovarian syndrome. We encourage recipients to partner as appropriate with organizations and institutions such as hospitals, clinics, and community and faith-based organizations that serve diverse races and ethnicities. Approaches should be developed to address health equity in underserved and disadvantaged populations, including racial, ethnic minorities, limited English proficient populations, and persons with disabilities. Next slide, please. Now to the award information. This grant is going to be for a total of $2.2 million and is available for up to 8 awards for a project period not to exceed 3 years. It will have an optional competitive 4th year to transition a successful projects to sustainability. Up to $300,000 will be awarded per budget period, and the budget period length is 12 months. Next slide, please. OWH expects this initiative to identify specific interventions that will lead to better maternal health outcomes through faster diagnosis and more effective treatment of endometriosis, fibroids, and/or polycystic ovarian syndrome in underserved communities. The goals of the initiative are threefold. 1, develop a demonstration project that implements and evaluates 1 or more evidence-based interventions to comprehensively diagnose and treat endometriosis, fibroids, and/or polycystic ovarian syndrome. Applicants may focus on 1, 2, or all 3 conditions, but must address at least 1 of the 3. That's very important. The second goal is to identify and track evidence-based outcomes to demonstrate improvements in early diagnosis and effective treatment of 1 or more of these 3 conditions. And lastly, to transition a successful project to sustainability. Next slide, please. I'm going to briefly go through the overarching themes of this notice of funding opportunity, beginning with the project narrative content. The project narrative is the primary basis to determine whether your project meets the minimum requirements for an award under this announcement. HHS OASH recommends that your project narrative include the following components. 1, statement of need. 2, and I'll go through this. 2, goals, objectives, and outcomes. 3, proposed demonstration projects that you are proposing. 4, your work plan. 5, how you will evaluate. 6, how you will disseminate your information. And 7, your organizational capacity. Under statement of need, describe in both quantitative and qualitative terms the nature and scope of the problem, the proposed intervention that you are proposing, and the conditions of focus. Remember, you must focus on at least 1 of the 3. Describe the population of focus, including demographic characteristics and the geographic location. Detail how the project will potentially affect the population served, specific subgroups within those populations, and other interested stakeholders as identified. For the goals, objectives, and outcomes section, you should start with a specific question or hypothesis you will address, the rationale for this hypothesis, and how your project's proposed goals and major objectives will address this question. Describe your objectives in this SMART format, that is specific, measurable, achievable, relevant, and time-oriented. HHS will not fund any project that does not include measurable outcomes. A measurable outcome is an observable end result that describes how a particular intervention benefits the project participants. Under proposed demonstration project, you should provide a clear and concise description of the intervention or interventions you are proposing to use. You should explain the rationale for using a particular intervention and present a clear connection between identified system gaps and needs and your proposed activities. You should detail the nature of the activities to be undertaken, why they were selected, how they address the identified issues, and how they will assist in achieving the overall project goals and objectives. Also describe how your intervention is evidence-based. For an intervention to be evidence-based, it must be informed by research and utilize effective methodology. In addition, your proposal should demonstrate how technology will be incorporated to advance programs and services, provide training or technical assistance, and/or disseminate information and products. In reference to the work plan, you will submit as a table or chart in the appendices of your application. Describe your implementation of the above approach over a 3-year project. Your proposed approach should include, at a minimum, a description of how you will develop a demonstration project that implements and evaluates one or more evidence-based interventions to comprehensively diagnose and treat endometriosis, fibroids, and/or polycystic ovarian syndrome. Identify and track evidence-based outcomes to demonstrate improvements in early diagnosis and effective treatment of one or more of these conditions, and a description of how you will transition a successful project to sustainability. For your evaluation section, describe the methods you will use to evaluate whether the proposed intervention achieves its measurable outcomes, and assess and evaluate the impact of activities you propose. In addition, describe the method you will use to disseminate the project's results and findings in a timely manner in an easily understandable format to the population served, the general public, and other parties who might be interested in using the results of your project. Finally, describe your organization's capability to successfully implement the proposed project. Again, please refer to the NOFO for the full details about these components. It is the NOFO against which your project will be judged. Next slide, please. Application appendices. Okay, in developing the project narrative, applicants should also take note of appendices to submit as a single electronic file attachment. Your work plan should reflect and be consistent with the project narrative and budget narrative, and must cover all years of period of performance. Each year's activities should be fully attainable in one budget year. Your work plan should include a statement of the project's overall goal, anticipated outcomes, key objectives, and the major tasks, action steps, or products that will be pursued or developed to achieve the goals and outcomes. If applicable and available at the time of submission, signed memoranda of agreement or signed letters of commitment should be submitted for each partner, or one signed memoranda of understanding with all partners. Memorandas of understanding must include specific roles, responsibilities, resources, and contributions of partners to the project. And lastly, include an organizational chart that reflects the management structure for your proposed project and demonstrates where the project resides within the greater organization. You must submit with your application curriculum vitae, resumes, or biographical sketches of the project director or principal investigator and all other key personnel, as well as references cited in your project narrative. Next slide, please. Lastly, the Notice of Funding Opportunity Supplemental Materials. Applicants should refer to the supplementary materials of the NOFO, which contain questions applicants may find useful in considering their plan for oversight of federal funds. An example work plan, disparity impact statement, and NOFO references are also included in this section. The example work plan template is just that, an example. It is not required. With that, I will now turn it over to my colleague, Dwayne Barlow from our grants department, and he will take you through the rest of the Notice of Funding Opportunity. Next slide, please.
Good afternoon again. My name is Dwayne Barlow, and at this point in the presentation, we're going to discuss application submission requirements. Next slide, please. So the application for this NOFO is due by 6 p.m. Eastern Time on July 7th, 2022. Your submission time will be determined by the date and time stamp provided by grants.gov when you complete your submission. You're strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Please note that grants.gov may take up to 48 hours to notify you of a successful submission. If you fail to submit your application by the due date and time, we will not review it and it will receive no further consideration. Next slide, please. Eligible applicants. So the applicant eligibility for this NOFO is as follows. Any public or private entity located in a state, which includes one of the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, U.S. Virgin Islands, Commonwealth of Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, Federated States of Micronesia, and the Republic of the Marshall Islands is eligible to apply for an award under this announcement. Community-based organizations, faith-based organizations, and American Indian / Alaska Native / Native American organizations are eligible to apply. Next slide, please. Examples include state governments, U.S. territories, county governments, city or township governments, special district governments, independent school districts, public and state-controlled institutions of higher education, Native American tribal governments that are federally recognized, public housing authorities and Indian housing authorities, Native American tribal organizations other than federally recognized tribal governments, nonprofits having 501c status with the IRS other than institutions of higher education, nonprofits without 501c status with the IRS other than institutions of higher education, private institutions of higher education, and for-profit organizations, including small businesses, are eligible to apply. Next slide, please. Cost sharing or matching. You are not required to provide cost sharing or matching in your proposed budget. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. During the merit review of an application, cost sharing will be only considered in the overall review of the adequacy of the total proposed budget, federal and non-federal share, to support the project proposed. Applications including voluntary cost sharing or matching that result in an award will include the cost sharing or matching commitment on the notice of award at the level proposed in the application. Any change in that commitment will require prior approval from the grants management officer. Next slide, please. The notice of funding opportunity announcement. So the notice of funding opportunity announcement provides information and guidance related to applications. Please read the entire funding announcement. Follow the NOFO carefully. And understand that the information provided in the NOFO, as we said earlier, takes precedence over any conflicting information in any other documents, including this presentation. Next slide, please. Requesting an application package. You can obtain an application package electronically by accessing grants.gov at the blue URL that you see below. And you can find it by searching the assistance listing number found on page 1 of the NOFO. The assistance listing number for this particular opportunity is 93.088. Please be sure to subscribe to an announcement in grants.gov so that you receive notification of any updates to the NOFO or supporting documents. Next slide, please. OASH requires that all applications be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. Please keep in mind that grants.gov is a website portal. All funding opportunities and grant application packages are made available on grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by OS Grants and Acquisitions Management, or GAM, division according to the deadline specified in the date section of the NOFA. Please contact grants.gov with any questions or concerns regarding the electronic application process. The number here, if you want to call in, is 1-800-518-4726. Next slide, please. Application submission. So applications must be submitted as 3 files. File 1 should be the entire project narrative. File 2 should be the entire budget narrative, including supporting documentation described in the budget narrative content section. File 3 should contain all documents in the appendices uploaded in the attachment section of your grants.gov application. Please note, required standard forms do not apply toward your page count limitations in the submission requirements as stated in the disqualification criteria. Next slide, please. Any files uploaded or attached to the grants.gov application must be of the following file formats. So you can use Microsoft Word, PowerPoint, Adobe PDF, or the image formats that you see here, JPEG, GIF, TIFF, or BMP. Microsoft Excel files will not be accepted. And keep in mind that HHS-OS strongly recommends that electronic applications be uploaded as Adobe PDF. So if you convert to PDF prior to submission, you may prevent unintentional formatting that might occur with submission of an editable document. And you want to check the page count of your PDF and or print the file to ensure that the document does not exceed the page limit. Next slide, please. Overall, with regard to application submission, please be complete and do not leave blanks on forms unless the information is clearly not applicable. The individual submitting the application forms, please keep this in mind, must have the legal authority to act on behalf of the organization. Next slide, please. To ensure the successful submission of your application, carefully follow the step-by-step instructions provided at grants.gov. And you'll see here in the blue, the URL for grants.gov. These instructions are kept up to date and provide links to frequently asked questions or other troubleshooting information. Next slide, please. So application elements. So with regard to forms, you want to have your application for federal assistance, budget information for non-construction programs, assurances for non-construction programs, a disclosure of lobbying activities, and project abstract summaries. For the project narrative, submit all project narrative content as a single acceptable file. Budget narrative, submit all budget narrative content as a single acceptable file. And same thing with the appendices. Please submit all appendix content as a single acceptable file. Next slide, please. Project abstract summary. If you receive an award under this announcement, your project abstract summary will be published. So don't include any proprietary or confidential information in your project abstract summary. Next slide, please. So for application format, just remember to please be sure to follow project narrative format instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. Keep in mind that you must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For appendices and budget narrative, you should use the same formatting specified for the project narrative. Appendix documents such as resumes may use alternate formats common to such documents. Next slide, please. The UEI number in the System for Award Management, or SAM. On April 4, 2022, the federal government completed its transition from using the 9-digit DUNS number as the official unique identity identifier to the 12-digit UEI number. The UEI will be required for submission of your applications. You may find additional information about the transition for both existing and new SAM registrants at the URL that you see below. Next slide, please. Your organization must register online in the System for Award Management, or SAM. Applicants are advised to begin the SAM registration process immediately. If you're selected for an award, an active SAM registration may be required prior to receiving that award. You should make sure your SAM registration information is accurate, especially your organization's legal name and physical address, including your zip code +4. Should you successfully compete and receive an award, this information as it appears in SAM must be included on a notice of award. And again, for instructions on updating this information can be found at the blue URL that you see here on the screen. Next slide, please. New registrations in SAM. If you are registering a new entity in SAM, you need to create a login.gov account if you don't already have one. Please note that the complete process for registering a new entity involves the submission of a notarized letter. The minimum time frame to complete an initial SAM registration online is about 30 minutes. The time frame for an applicant's registration to become active is up to 10 days and may take longer depending upon volume. Now, the average time frame for updates in SAM.gov to appear in grants.gov is up to 72 hours. So you want to make sure that if you're a new registrant, that you get your registration completed as quickly as possible in this process. Next slide, please. Renewal registration in SAM. SAM registration must be renewed each year. An active SAM registration may be required prior to receiving a new or continuation award. If you are renewing your registration, your old SAM.gov username and password may not work anymore. You'll need to create a login.gov account if you don't already have one. Please review the information on SAM.gov regarding transition of existing registrations from DUNS to UEI. Next slide, please. We strongly recommend that applicants check for an active registration in SAM well before the application deadline. If you are successful and you receive an award, you must maintain an active SAM registration with current information at all times during an active award. If you have not complied with the SAM registration requirements, HHS-OASH may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Should you successfully compete and receive an award, all first-tier subaward recipients must have a DUNS/UEI number at the time you, the recipient, make a subaward. Next slide, please. Funding restrictions. If you are successful and receive an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75, currently in effect or implemented during the period of award, other department regulation and policies in effect at the time of the award, and any applicable statutory provisions. Keep in mind that costs must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with the regulations and current policies. Indirect costs may be included per 45 CFR 75.414, and applicants should indicate which method or rate is used for this application. Pre-award costs are not allowed, and the current salary limitation is $203,700 effective January 2022. Next slide, please. Budget narrative and forms. Keep in mind that you must be consistent with the requirements of the nofault. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in the NOFO. Suggested table formats are also in the NOFO. Keep in mind that you have to include a plan for oversight of federal award funds. And also note that forms, budget narratives, and detailed justifications do not count toward page limit. Next slide, please. Disqualification criteria for the application. If your application does not meet the following requirements, it will be disqualified and receive no further consideration. So it has to be submitted electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. Keep in mind that if you successfully submit multiple applications for the same project, we will only review the last application received by the deadline. HHS, OASH, and GAM have to deem your application eligible. Keep in mind that you must complete the required forms in the application package, the SF-424, SF-424A, 424B, the SF-LLL, and project abstract summary. Also, your application must be submitted in the English language and must be in terms of US dollars. Next slide, please. Keep in mind that the project narrative must be double spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all sides, and font size must not be less than 12 points. The project narrative must not exceed 25 pages, and the total application, including the project narrative, must not exceed 50 pages. Next slide, please. With regard to application disqualification criteria, we also want to mention to you that your federal funds requests, including indirect costs, should not exceed the maximum indicated in the award ceiling, which here is $300,000. And your federal funds requests, including indirect costs, must not be below the minimum indicated in the award floor. And as we state here, there is none. If you have included voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. And your application must meet any application responsiveness criteria under Section 3.E other application responsiveness criteria. Next slide, please. Okay, so for that other application responsiveness criteria, you must identify in the first paragraph of your project narrative at least one of the 3 conditions that you focus on in your project. You may focus on 1, 2, or all 3, but you must state at least one of the 3 to be responsive. Next slide, please. Applications that lack the required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application scoring under the evaluation criteria. So please be sure to follow the submission instructions carefully. Next slide, please. Okay, so here's a list of the application review criteria elements. So you have the statement of need for 5 points, goals, objectives, and outcomes, 15 points, proposed demonstration project, 25 points, evaluation, 20 points, dissemination, 10 points, organizational capability, 20, and then finally budget, 5 points. Next slide, please. Application merit review. So eligible applications will be reviewed and assessed by a panel of independent reviewers with technical expertise in the applicable fields according to the criteria listed in the NOFO. The merit review process is formal and confidential. Federal staff are available to answer questions and to ensure the process is consistent and fair, but do not participate in discussion and assessment of the application. Then the applications are reviewed by the grants management staff for administrative and business compliance, and then by the OWH program office for staff and the program staff, for programmatic compliance. Next slide, please. Okay, so with regard to funding decisions, the Deputy Assistant Secretary for Women's Health will make final award selections to be recommended to the Grants Management Officer for risk analysis. You should note here that additional consideration factors for the director will be equitable geographic distribution of award recipients. Now, upon completion of risk analysis and concurrence of the Grants Management Officer, HHS-OASH will then issue notices of award. Keep in mind that no award decision is final until a notice of award is issued. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Keep in mind that we're not obligated to make any federal award as a result of this announcement. Only the Grants Management Officer, known as the GMO, can bind the federal government to the expenditure of funds. If you receive communications to negotiate an award or request additional or clarifying information, this does not mean that you will receive an award. It only means that your application is still under consideration. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Funding process. Review of risk posed by the applicant. So HHS-OASH will evaluate each application in the fundable range for risk posed by the applicant before issuing an award in accordance with 45 CFR 75-205. OASH will use a risk-based approach and may consider any items such as the following as stated in the nofault. So we're going to take a look at the applicant's financial stability, the quality of management systems, and the ability to meet management standards prescribed in 45 CFR 75. We'll take a look at the applicant's history of performance. We'll look at reports and findings from audits performed, and we'll take a look at the applicant's ability to effectively implement statutory, regulatory, or other requirements imposed on the non-federal entities. Next slide, please. Plan for oversight of federal award funds. If your internal controls are available online, you may provide the link as a part of your plan in the budget narrative. We've also included supplementary material, which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. Non-funded application as a result of risk review. If we determine that your organization does not meet either or both of the minimum qualification standards as described, 45 CFR 75-205A2, and we do not make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. The information reported in FAPIS is available for other organizations to review when considering you for an award. Next slide, please. Okay, the notice of award. What it does is it notifies the successful applicant of the selection, the award amount, the project and budget periods. It includes any conditions on the award, i.e. requirements that must be met as a condition of receiving the grant funds. And it includes standard terms, reporting requirements, and contact information for OASH grant staff and the program office. Next slide, please. Points of contact in the funding process. GAM, or the Grants Management Office, is the official point of contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by the program office via letter. Next slide, please. Okay, here are summary tips for successful application submission. Project narrative and description. Please be clear, complete, and concise in the project description. Follow and address exactly what is requested in the nofault. Do not make the reviewer search for the required information. Generally, the easier the application is to review, the better the rating or score. Reviewers are not allowed to do external research or follow embedded links, and so that's why we make that statement. Clearly identify the sections of the application and indicate which component is being addressed. The project narrative must include all required information within the page limit. Do not use appendices to expand the page limit. Next slide, please. For your project narrative descriptions, please make sure that your goals and objectives are SMART, specific, measurable, achievable, realistic, and timeframe, if required in the NOFA. The activities you present in the work plan should relate directly to the proposed goals and objectives. Your program work plan, evaluation plan, and other requested planning documents and the budget should provide a complete picture of how you will address the needs, as well as address the purpose and expectations in the NOFA. Next slide, please. With regard to staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what your staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. For your budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. Your budget should be reasonable and relate directly to the goals and objectives of the project. Do not request more funds than are available as listed in the NOFA. This amount is inclusive of indirect costs. The operation budget should be complete and include federal and non-federal funds, projected program income, for example, fees from third-party payers and other contributing funds. Next slide, please. Overall, please include full names, that's first, middle, and last, for authorized officials, principal investigators, and project directors, and all essential or key personnel. Electronic submission for this particular NOFA is required. Do not wait until the last minute to begin SAM registration or update your registration. And please don't wait until the last minute to begin electronic submission. Problems could arise. Next slide, please. Okay, with regard to no-fault inquiries, for program questions that you may have, please contact Ms. Linda Stella. Her email information is on the screen here, as well as her telephone number. And for administrative or financial questions, please reach out to me. And as you can see, my email address and my telephone number is listed below. For electronic submission requirements and grants.gov applicant support, you can use the www.grants.gov URL to go to grants.gov. You can actually email support at grants.gov to get any answers that you may need in the electronic submission requirement. And the telephone number, if you want to call them directly, is 800-518-4726. We just want to remind you here to please do not contact the OH program or grants office staff for grants.gov issues because we don't manage that site. Next slide, please. Now, at this point, we're at our question and answer session, and I would like to turn it over to Lieutenant Candace Humphrey in the Office on Women's Health for this session.
Good afternoon, everyone. We would now like to begin the question and answer session of the webinar. Please continue to use the Q&A window on the right side of the platform to submit your questions and ensure you select everyone when submitting your question. So questions submitted during this webinar will be addressed in the FAQ document, which will be posted to grants.gov. We'll begin with the first set of questions focused on eligibility. So what applicants are eligible and how will they be defined for this particular funding opportunity?
I'll take that question, please. This is Dwayne. So as we stated earlier, any public or private entity located in the state, and that includes, again, one of the 50 United States, District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of Northern Mariana Islands, American Samoa, Guam, Republic of Palau, the Federated States of Micronesia, and the Republic of Marshall Islands is eligible to apply for an award under this announcement. Community-based organizations, faith or based organizations, and American Indian, Alaska Native, Native American organizations are eligible to apply.
Thank you, Dwayne. So now for a question about preparing to apply. What's the deadline for to apply in response to this funding opportunity?
I'll take that one.
So,
Dwayne?
Sure, I'll go ahead and take that. Your application is due July 7th, 2022 by 6 p.m. Eastern Time. If you want to receive consideration, you must submit your application electronically via grants.gov no later than this due date and time. If you do not submit your application by the specified deadline, we will return it to you unread.
So how can applicants stay up to date on any updates or changes to the notice of funding opportunity or any additional information on resources and other developments?
I can take that one. The best way to stay up to date is what I mentioned at the beginning of our presentation, is to go to grants.gov and click on the search grants tab, which is, I think, in the upper left of the screen. Then just go sort of to the basic criteria, search for the grant, and enter the grant opportunity number, which is WH, which it's on the front page of it, WH-AST-22-001, and then just click search. And also, we just really want to emphasize the importance of subscribing to this particular funding opportunity, because if you subscribe, then automatically all of the updates that are made to this opportunity will be sent to you, and then you'll be up to date on all of the information as you try and get your application in. So just really want to encourage you to subscribe to this notice of funding opportunity. Yeah, that's it. Back to you, Candace.
Thanks, Linda. So finally, we have a few questions related to the program. So what's expected of applicants?
Basically, the first thing that's expected is to meet the initiative's goals, which are threefold. Develop a demonstration project that implements and evaluates one or more evidence-based interventions to comprehensively diagnose and treat endometriosis, fibroids, polycystic ovarian syndrome, which contribute to risk factors and inequities in maternal health outcomes in underserved communities. So just to really drive this point home for everybody on the call, you can focus on one, two, or all three of the conditions, but you must address at least one. So if you come in with an application that is not focused on one of those three, it will be rejected. So that's the first thing. Develop some demonstration projects. Second is identify and track the evidence-based outcomes to demonstrate improvements in early diagnosis and effective treatment of one or all three, or up to all three of those. And then lastly, to transition your project, which will hopefully be a very successful project, to sustainability. So as you create these projects and they're helping women all over America or in your communities, that it will continue past the funding of this particular government funding. So those are the three things that are in throughout the NOFO, so you should be able to find them, but if not, please reach out and we'll be happy to help with that.
Thanks, Linda. I see another question here. So who should I contact if I still have questions about the NOFO or questions about developing my application?
Right, so that's a good question. It really depends on the nature of your question. So for programmatic questions, please reach out to me. I'm Linda Stella. It's linda.stella@hhs.gov. But please CC Dwayne Barlow, because Dwayne and I are working hand in hand on this. So, it's important to keep him in the loop as well. His is dwayne.barlow@hhs.gov. And if you have any questions that are really related to the financial or the grants related questions, please send those to Dwayne, and then you can CC me, and then just keep me in the loop on those as well. So programmatic questions more for me, grants related questions, financial questions to Dwayne. And if you don't know, just reach out to one of us and we'll get you to the right place.
Thank you, Linda. As a reminder, the slides will be posted on grants.gov, and the webinar recording will be available on OWH, the Office on Women's Health YouTube channel. And probably 24 to 72 hours. This concludes today's webinar. So we thank you all so much for your interest in this funding opportunity, and best of luck in the application process. Thank you.